Thank you for joining us for this special look back at 2023. I'm Naiba Reynoso. The journey to parenthood wasn't easy for Joe McDonald and his husband Carlos Castellanos, but after adopting their first child from the Department of Children and Family Services, they were ready to welcome a new daughter into their lives when a caseworker came calling.
Today is Camila's adoption day. It's the day we've been waiting for such a long time. It's finally here. Feels surreal.
We're very grateful to be here, for DCFS, to everybody who's made this reality, our family, to make this reality possible. I never thought I would get to this day. I'm gay. I didn't think it was possible for me to ever adopt. So this is a big day for me. I grew up in the 70s in a very conservative Orange County, and having children was just not in the cards for me. And then I met my husband Carlos, and he said he always wanted to have children, and I always wanted to have children.
There have been so many highs and lows on our journey to parenthood. When I first met Joe, 3 months into our courtship, I was diagnosed with stage 4 Hodgkin's lymphoma. He wanted to be there with me through that journey. He used to sleep on the floor at the hospital. It was in those darkest moments when we used to make plans for the future. He would say things to me like, when you get through this, we're gonna get married. When you get through this, we're gonna adopt children. I reached remission in February of 2015, the same summer that the federal government legalized gay marriage. We got engaged, and then we started on our adoption journey.
I happen to be a producer for the LA County channel, and in covering our stories for what we do for Department of Children and Family Services, or DCFS, I found out that not only do they want all walks of life to be foster parents, but they want gay people too. And I thought, wow, this is an opportunity for us to adopt a child through the system and really make a difference.
Throughout Los Angeles County, there's a need for resource parents. The process that anyone goes through, whether it's same sex, whether it's you're single, whether you're married, it's more traditional families, the process is the same for everyone across the board. We need a diverse pool of families to place children in and to increase our placement capacity.
This is actually the second child that we've adopted, me and my husband. My son Dominic has been with us since he's 18 months old, and he's now almost 7.
We met Dominic Thanksgiving weekend. By December 17th, it was in our home. So it was like an early Christmas gift for us, and it's been wonderful. You know, I never thought that I would get the opportunity to raise such a beautiful boy. I always had hopes for a second child in my head, and in my heart, I always knew I was destined to have a baby girl. I always loved the name Camila.
All of a sudden, the stars aligned, and we got a call for a safe surrender baby. A child who has been surrendered safely within the first 72 hours of their life.
I had just lost my grandmother the August before we met Camila. When we got the call for Camila, and we got to the hospital, and I held her for the first time, I can't explain it, but in that moment, she felt very familiar to me. And it's almost like I felt my grandma wrapping herself around us in that moment. And I just felt like it was right. And that's how I knew that she was meant to come home with us. The nurses in the NICU had already named her Hope. And so we incorporated that into her middle name. The nurses said that's what they wished for her most. They hoped for her to find a loving family, and I think she's found that with us.
I'll teach her how to do writing, reading, a lot of things, and maybe even harder things.
Her name officially is Baby Girl Doe, and it will be, after the adoption, Camila Hope Castellanos McDonald. She's gonna have our name, and she will have a place in the world here in our family, and we'll get the chance to watch her grow up and help her become the woman that she's meant to become. And I can't think of anything better to do with my life. They made the process really simple. They come to your house, they do a background check, fingerprint check, and they go through your house and make sure everything's safe for the kid.
It's important that we get to know you and we meet certain state mandates and requirements before we can actually approve your home. So that'll include some documentation, interviews.
My life had meaning before, but now it has meaning exponentially because it's just everything is for this child that I had the privilege to bring into my life. Carlos tries to teach her some Spanish.
Agua.
And just, we're all laughing together, and it's been truly magical.
Growing up in a very traditional Mexican family, being gay is often seen as the opposite of being successful, the opposite of something to be proud of. Now they see that I'm in a really good place, that I've got a really great partner, that we've got beautiful children, and that we've made it work. There's no guide for how to be the perfect parent. It's just about showing up and doing the best that you can, and that's what we've been doing.
I call it a miracle. I call her my beautiful butterfly. It's very emotional. The whole family, as you can see, welcomes her, loves her.
It's just been wonderful. Our family feels more complete. Our lives are just way more hectic, but it's a really beautiful, beautiful thing.
I'm so excited to have that opportunity. I never thought I would, and I do, and I'm just thrilled.
Wanted, chosen, loved, and adopted. Camila Hope, born April 16th, 2022. Forever a family. Today, June 6th, 2023.
The county launched Pathway Home this year, a major expansion of efforts to resolve encampments and bring unhoused residents indoors. One of those successful operations took place in unincorporated Lenox that helped 59 people move inside. Here's more.
One of the main priority areas with the emergency declaration is encampment resolution. And in Los Angeles County, our program is called Pathway Home. And today is the first day of Pathway Home. Today we are here at this encampment in the unincorporated area of Lenox and near the city of Inglewood.
This is something special. Today we're going to be moving over 50 people indoors on a pathway to their own permanent housing.
LASA's role is to work with everyone in the encampment and have them move out of their tents into a motel that's local.
I got emotional, the folks got emotional because actually doing something for the homeless folks.
There will be on-site services. There will be food provided for everybody, case management services, connection to any health, mental health, substance use services that they need, as well as getting them any benefits that they're eligible for to make sure like they have Medi-Cal for health care or CalFresh benefits or general relief benefits. A very important part of what we're going to do today, as well as we bring people inside, is make sure that they have any documents that they need that will help them get permanent housing.
But yeah, I left everything except for clothing. And paperwork and medicine.
That's all you're bringing with you.
I have congestive heart failure, so getting out of here is saving my life.
Really important to go the next step in outreach, which is not only are we reaching out and inspiring people to accept services, but we're also saying we have something in hand that you need. Housing today, someplace safe for you to live, take a shower, and settle in to a new life path, and also a hope that they will then move into permanent housing. And I think that's what really gets people, is it's not just about moving today into a motel, but it's the long-term plan of moving them into permanent housing. That's the game changer.
Like many Angelinos, Brenda Lopez fell on hard times after a series of life events spiraled out of control, and she ended up living in her car while caring for her special needs son. But thanks to an organization helping people like her, she's now housed, employed, and full of hope.
So I was a drug addict about 5 years ago. I was pregnant, still using, and I lost custody of my son. When I did get back custody, we moved in with my sister in a one-bedroom apartment. It was my mom, my sister, her 2 daughters. My son, he was born with a lot of disabilities, so we also included a nurse. So it was 7 of us in a one-bedroom apartment. They raised the rent. The building was bought out by somebody else, and we weren't able to pay the rent anymore, so we got evicted. We stayed in the motels, and we kept asking for help through LA Family Housing. and DPSS, the welfare office. Once the money was out, the vouchers were exhausted, all the help that we could get was exhausted. We packed up everything from the motel and we stored it in my sister's small car. So we went to LA Family Housing and they referred us to Hope of the Valley, a family shelter that they had, and we lived in that family shelter for a whole year.
As an organization, we have different bridge homes, we have different tiny homes, we have different family shelters as well.
We struggled a lot because we had to go to the hospital at 5 in the morning when we were at the shelters. We would catch 2 or 3 buses, make it on time to our appointment at 8, 9 in the morning, and then be back by 2 or 3. The bus stop was maybe like a block away. And it was during the winter, so it was super cold, like cold. I had to carry the oxygen, the stroller. My mom used to come and help us because she was my son's aide. So it was the 3 of us with the stroller. We used to wait for the bus. Sometimes the bus wouldn't even pass because it was so dark in the morning. One morning they just called us, hey, come to the office. We need to talk to you and your family. It was a donor that donated us an apartment with the rent paid for a whole year. We got a van donated. After that whole year, I was able to apply within Hope of the Valley. I got hired as a hygiene attendant and at this specific site. So I was cleaning showers, I was cleaning the restrooms, I was helping clients, giving them hygiene, helping them, showing them where to go. Put a towel, shampoo, and conditioner, lotion, whatever was donated, and then we'll have it ready for the next client. From there, I got promoted to employment specialist. I had never helped anybody get a job. I couldn't even get a job myself. I was promoted to program manager for the job center. And then a year later, I was promoted to program manager for navigation center. I oversee 10 employees who assist our clients in enrolling into our center. We have hygiene services, which includes showers, restrooms, any hygiene products that they might need. We also have a bin storage. Whatever fits in that bin, they could store, so they don't have to be walking around with it.
Brenda has grown at this site. She started as a hygiene attendant and she always showed ambition. She always showed dedication to all her positions, and wanting to start from the bottom and build her way up has really shown through her actions, and that is why she was the best candidate to oversee the whole site.
Now she's overseeing the North Hollywood Navigation Center, servicing those people experiencing homelessness, the undocumented communities, and even conducting outreach to further go outwards outside of North Hollywood.
When I was homeless, I felt like I was living a double life because I didn't want people to know I was staying at a shelter or I was staying in the motels. And now that I have my house, my car, everything, I feel proud about myself and proud about my sister and my family because we were able to make it out. I feel like a mom, like a real mom. He's into music, he loves guitars, the accordion, he loves playing the drums. He was born with a lot of medical issues. Larsen syndrome, bilateral cleft feet, he had a collapsed lung, his airway was floppy, he has severe scoliosis. Keep going, don't give up. There's hope, there's light at the end of the tunnel. Just keep going. I think we just need a second chance at life, whether it's working, being around people, socializing with people. Don't judge us. We also have heart, we also have feelings. We're just going through some tough times and we just need that hand and be available to our homeless community.
With Measure H's funding, we were able to open up new programs within Hope, such as our MDT outreach team, provide services out in the field where some may not think that there is a second chance for them. We are here to help. We are here to give you that second chance. We are here to give you that glimmer of hope to start a new life.
You could reach us at hopeofthevalley.org, and you could also call our number. We have a lot of help, a lot of good help.
Charlie LeBeau is one of thousands of youth living on LA streets or scrambling to make ends meet to stay housed. Enter Dunamis House, a unique community giving youth like Charlie a safe space to get their lives on track and pursue their dreams.
My name is Charlie LeBeau, and I'm 19 years old. I ended up without a home because I used to live with my dad and my sisters, and it was not a good environment. My emotional state at that time was really messy. Not really feeling a sense of control with housing, or not really knowing if I was going to have to go without some meals for a week or so. I had the opportunity to arrive at Dunamis House, and I've been here ever since, and it's been a really good fit.
With the help of the county through Project Homekey, the Dunamis House is going to be home to 62 students who are experiencing homelessness or at risk of homelessness. And we aren't just about providing a bed. We're not a shelter. Folks can learn from each other, take advantage of all the resources that we have through our academic success and college completion sort of work, our financial literacy and planning, our job readiness and career development work, our mental health and wellness work that we do with our case managers.
Being a student already isn't easy. There's a lot of stress with exams, or making sure that you can buy all the materials, or attending class consistently. And when you're homeless on top of that, and you're never sure whether or not you're going to have a shelter or a place to rest your head, or the ability to get to and from school, it does add a little something extra on your mind.
Homekey is a state-funded program that is done in partnership with local jurisdictions, and the county has partnered with LA Room and Board at Dunamis House to provide young adults with a safe and welcoming environment. An estimated 3,700 young adults ages 18 to 24 are experiencing homelessness, according to the 2023 homeless count. The county has made it a priority to support young adults who are at risk of homelessness.
This is my room. This is where I study. This is where I sleep and just relax. I remember I used to have to go to the computer lab all the time when I was living in the emergency shelter, and it only had a certain amount of allotted time, so I would get there early in the morning and then be there until late. But here I can work as much as I'd like. I couldn't ask for a better workspace.
Give them the opportunity to sort of say, I don't have to worry about rent, my utilities, food. Now I have everything I need to just focus like a laser on my academics, or focus like a laser on exploring what it means to sort of use my gifts and talents to find the career that I love. I wanted folks to come into this space and feel whole, to feel healed. And I think that the built environment can be healing. Charlie, what's up?
Thinking back about where I was then and where I am now, I'm a much happier person. I'm more confident. I feel passionate about my goals. I'm really excited to continue with my academic work, and I feel like this is the perfect environment to just focus on that.
Preventing Black infant mortality is a public health priority. The Black Doula program aims to fundamentally shift the statistics and help keep babies and their mothers alive and thriving.
Hey, Molina. Hi, Nikki. How are you? Good. How are you? I'm good. My name is Lorna Leverett. I am a community doula for the AIM Doula program. The AIM Doula program is an LA County sponsored program that offers doula services for African American moms.
Being a first-time mother is, only thing I can say is there's no manual.
Well, go ahead and get some rest, Nikki.
Thank you. Thank you. I'll be back.
Okay. Doulas provide emotional support, educational support, and physical comfort. This program is all about teaching African American mothers about birth, telling them their rights, their choices in the hospital, and just making sure that they have better outcomes.
I am 36 weeks pregnant, so I am in my 9th month. This is my 2nd pregnancy, and having the doula, Lorna, has been a big help. There was things that I kind of just winged the first time and kind of went with whatever I was told or read or whatever. But this time I've actually been researching things that I've learned from our sessions with Lorna. It has empowered me, especially going to the doctor when they say things, I'm kind of like, okay, yeah, I already knew that.
The statistics show that in Los Angeles County, the Black infant and maternal mortality rate is disproportionately different than the other racial groups. Black infants are dying at a higher rate, and Black birthing persons are dying at a higher rate because of racism and the physiological toll it takes on Black birthing bodies. And so with the AIM Prevention Initiative, which is the African American Infant and Maternal Mortality Prevention Initiative, our goal is to reduce that rate by 30%, and it's a Los Angeles County priority. And we do so by providing doula services for free.
Babies have reflexes, so what you want to do is bring your nipple to the top of her nose and down so you can engage a gape.
Okay.
When African American women sign up, what they get is 3 prenatals, continuous labor support, and 3 postpartums. Prenatal is mostly education and infant feeding and infant care. Postpartum is mainly infant care done by me while mom rests. We're done. It's okay. It's all right.
If I reached out to Lorna, she was able to give me either some kind of advice, or she was able to send me to someone who did have advice, because she's dealt with so many different babies and so many different pregnancies that she's able to give me advice, and I trust her advice.
How are you? I see how much of a difference it means to these women, especially first-time parents. All of the ligaments loosen up for baby to come down easily. Okay. And even though it's helping the baby, it hurts her. So when we help relieve that pressure, it feels good.
I love the information and the research-based information that's provided by Lorna. I think it brings us together more, just to love and support one another and be there for each other throughout the process.
Over 80% of our clients report that having their doula reduce their stress levels during pregnancy, labor, and delivery, as well as 95% have had an overall satisfaction with their doula and their doula services.
Things aren't just happening to my clients. They know their choices. Everybody deserves that up close and personal support, beginning, during, and the end.
When you have someone that is invested, but also still not in your family or not as close to you, they're kind of like a third party, but they're still invested in your health. That's something that you can't buy. So I was really very, very, very grateful. It was kind of the best thing that ever happened to me.
A nonprofit funded by the Department of Mental Health provides non-traditional forms of healing, like knitting, to local residents struggling with pain. Knitting offers an escape, but it's the sense of community that helps them move on.
Hi, my name is Rem Nunez, and I'm the director of the Innovation Soup program with Alma Family Services. The Innovation Soup program is a program that's funded by LA County Department of Mental Health, that it really supports non-traditional forms of healing. It's a trauma-informed grant that started, I'd say, about 5 years ago. And its aim was to provide the community with trauma-informed programming that can go parallel to the therapeutic services that the county currently offers to the residents of Los Angeles.
Hi, Ava, how are you doing?
I am good. I'm doing fine.
The nice thing is that when we come together as a group in our little club, a little knitting group that we have together, it brings them all together because they have a lot of things in common. Age is a big thing they have in common. They all have a passion for knitting. They all have a passion for the community. They all have similar struggles that they've gone through, that we try to help them and support them and be kind of a rock there for them to help in any way we can.
Mi nombre es Alma Crespo, yo soy de las que empezamos con la clase de tejido, por la razón de que yo entendí que esto nos ayudaba mucho con nuestra salud mental y a la vez a las manos a que no se quedaran rígidas por los problemas que tenemos de artritis y todo eso. Y es una de las razones por la que yo me siento muy satisfecha de lo que hacemos, porque es una razón que como personas mayores agarramos un nuevo aire para seguir adelante luchando.
this beautiful vest that you're doing. Can you show us?
Yeah. It's finished now.
It's almost done. It's almost done. Whether it be like just to listen to them and hear what they have to say and express their feelings, or also providing further services to assist them in their time of needs as well. Because life isn't perfect. Sometimes we have bumps in the road and we have a hard time, but as a community, as a group, and also as an organization, we try to come together to help as many people as we can, when we can, and in their time of need.
One of the beauties of this program is that it's evolved and grown over the pandemic. We had to switch into virtual, we had to pivot, and we've been able to partner with LA County USC, known as General Hospital, to get all the items that we knit, to be able to donate them to children who are in incubators, all the way up to elderly folks who are navigating cancer. So just every year we get together to do a distribution with the hospital, and we work with the spiritual care department to distribute the knitted items to hospital patients.
A stray bullet looked like it would end a 6-year-old boy's basketball dreams, but Willie Young III had other ideas. Watch his story of grit and perseverance as a player in the wheelchair sports program at LA County's Rancho Los Amigos National Rehabilitation Center.
My name is Willie Young, and I am 12 years old. I never thought I would be playing basketball.
Willie was 6 years old. And on January the 7th in 2017, he was struck by a stray bullet. He and his sister, they were just playing out of nowhere. Shots rang out. One unfortunately hit Willie in the upper quadrant of his left lung, and it exited next to his spinal column.
We found out that he was paraplegic. There was no movement there from the chest down. We said, okay, we're going to Rancho. And off to Rancho we went.
Rancho Los Amigos changed everything, not only for him, but it changed it for us as well. What they did for us is show us that indeed we can do this. We are up to it. They gave us the skills to help him care for himself in every way that he would need moving forward. The recreational therapist at Rancho had been mentioning the wheelchair sports program. And so we went to the old tennis court and we heard the dribbling of balls, we heard the laughter of the kids. These kids, they were wide open. They were zooming right past each other. It was one of the first times in a few weeks that I saw Willie truly excited about something that he would be able to do in a wheelchair.
This is our basketball court right here. The Rancho Los Amigos Wheelchair Sports Program is a program for adults and children. It's a competitive and a recreational program. We're teaching wheelchair basketball, and it allows people with physical disability to be able to play and compete with their friends. Well, this is a wheelchair basketball chair, and so the wheels are cambered so that you can turn really fast, and then there's 6 wheels, so you're not gonna flip over, okay? During their rehab program, we will work with them daily, trying to teach them the simple skills of wheelchair basketball, and then after that, when they get discharged, we'll introduce them to our wheelchair sports program where they can transition and be able to practice more and be able to compete just like regular basketball, okay? So for every 2 pushes, you have to at least dribble once, or it's travel.
I've been coaching Willie Young since he was 6 years old. A new injury, kids are very shy about, or they're very timid. Watching Willie, how much he's grown mentally with the game. He knows how to shoot, he knows how to push. Program is, we really want the kids to understand, we want you to keep on moving forward with your life. It's not a matter of feeling sorry for yourself, but to understand that we really want you to see what's out there. That's what the program is all about, is to really understand that, hey, you can do anything you want as long as you have it in your heart to do this.
Right out of rehab, he was already in basketball practice, and he started with the Futures, which is the lowest level of the team. He started with the Futures, and the rest is history. I mean, now he's traveling. He's on a traveling basketball team. Basketball has brought to Willie's life a lot of joy, a lot of excitement, being independent, being able to be around peers in his same condition, and just to be a kid and just to live a normal life like everybody else is.
It's a continuum of care, from inpatient to outpatient to being able to get out into the communities. It helps our athletes mentally, physically, cognitively, and emotionally to be able to get back out there after living with an injury.
Although we have been told about the wheelchair sports program, we didn't know how you were going to adapt to it. We didn't know if it would be for you. We didn't know if you would like it. But, you know, I get a real thrill seeing you out there competing, getting sweaty, fighting over the ball. And, you know, I'm really proud of you. I know that you can do so much in this sport, in this chair, and you can be great. Just know that we're proud of you, and we love watching you play. Nice shot.
It has been a long journey. From the time I was in a hospital till the time like now that I get to play on the court. I'm grateful for the opportunity to play basketball. I hope that I could play in the Olympics. That's my goal. I won't let anything stop me.
Meet Herbert and Aurora, Skid Row outreach workers giving back to the community they came from. Aurora works in harm reduction. Herbert works at The Refresh, a 24-hour hygiene center in the heart of Skid Row. Together, they are a force for changing lives.
My name is Aurora Morales. I was homeless for about 2 years. I wasn't just experiencing homelessness, I was also really high.
My name is Herbert Morales, and I used to be reckless. A lot of violence, drugs, making easy money, incarceration. My main concern is making money to get high.
I remember one day my son telling me, "Mom, I'm hungry." And I didn't have anything to give him because I just made bad choices. I made bad decisions. I just remember just feeling so desperate and in need, not having an answer, not having any help.
I arrived in Skid Row with 2 duffel bags. I bounced around to a lot of winter shelters. I didn't feel comfortable. When we got married, we became one. So we're a team, we're together.
Fast forward now, I'm working for Homeless Healthcare Los Angeles. I'm a team lead for the Overdose Response team in Skid Row. We look for people who are experiencing overdoses and we reverse them and save their lives.
Now I work for Homeless Healthcare at the Refresh Spot. I love my job. I love giving back. I love being able to speak to people and give them hope and help them where they're at.
We're in the middle of the biggest overdose crisis we've ever faced as a community. The county believes that supporting harm reduction is our pathway through this crisis, and we are investing both in our staff efforts and personnel, workforce training, and other types of overdose prevention training, as well as investing deeply in the community providers themselves.
The Center for Harm Reduction is one location in Skid Row, operated by Homeless Healthcare Los Angeles, that most directly targets our services to people who are actively using drugs. Our overdose outreach team is funded by that part of the county. That's the team that Aurora oversees. Her current work at the center is responsible for saving hundreds of people's lives directly. Just since the team launched in December, our staff, Aurora's team, and our clients have reversed over 300 overdoses in the community.
So these are oxygen tanks that we use for reversals.
I always see myself like that could have been me, you know. I could have been in that position.
Me cleaning the restrooms at the hygiene center at the Refresh Spot was a big thing for me, you know. Just It felt like I'm doing something good for the community, helping out. Something that I would have liked that was there for me when I was in my journey.
People with lived experience have to deliver the services. They must come from the community that they're serving. Herbert and Aurora are two people with the lived experience, and bringing that to their work every day means that people connect with them. There's a shared background, a shared story that can create trust where there generally isn't trust.
Our faith in Christ is what brought us here to this work.
I want to do this kind of work because I want to give back. I want to be able to help those that are in need like I once was. Not everybody gets people who are experiencing homelessness and who are actively using substances. They don't. They just criminalize it. They look at it at this negative lens, and that's not what's needed. What's needed is people who genuinely care.
We know that it's easy to love somebody that's lovable. It's hard to love somebody that nobody wants to deal with. You know, that was me back then. That was me. You know, if I could be there in their journey and stepping stone and that I was part of their journey, you know, to help them, it's fulfilling to me.
The death of former LA County Supervisor Gloria Molina this year inspired an exhibit at La Plaza de Cultura y Artes that explored her legacy, artistry, and contributions to our civic life.
When former Supervisor Gloria Molina announced that she was in this transitional moment of her life, we knew that we needed to find a way to honor and celebrate her. We immediately put at the altar, which is an important part of our culture. Now, this is the house that Gloria built, we say. It was her vision many years before we actually even opened our doors. So in 2011, La Plaza, officially became a county cultural institution. But it was because she knew that Los Angeles needed a place, historical place, to tell the stories of Mexicans and Mexican Americans and all Latinos. She was from the community and of the community and by the community. And you hear that a lot, but she demonstrated it every day. You can walk over to Gloria Molina Grand Park next time you want to sit on a pink bench. It was Gloria's vision to create an open green space for Los Angeles, the extension of the Metro line into East LA, the work that she did at County USC, and La Plaza. So her legacy runs deep. She was this really powerful, strong politician, and she was, but she was also a mom and a grandma and a friend and a sister, and you see it in her artistry, right? She was a quilter. From afar, you look at it and it's this rose, and then you get close up and it's a fist, right? It's just, yeah, it says everything about, I think, who Gloria Molina really was to her community. We have 2 of Gloria Molina's quilts. We're gonna frame it and take very good care of it and put it up for permanent display. And then we also created an opportunity for the community to come in, and a space where people can actually talk about how she inspired them to do good in their own communities. And so the Community Quilt of Hope, which is, folks can come in, fill out a fabric square, decorate it, put words on it. So the quilt the large quilt that we have here is called Corazon, and it actually is a large heart with wings, and on one side it's Los Angeles, and the other side it's Puebla, Mexico. And it really does tell the story of Mexicans and Mexican Americans here in Los Angeles, right? She will always be watching over us. You step into La Plaza and you know it and you feel it, and this just is a visualization of that embrace that we all will feel, because it's comforting to know that she's still here with us.
Thanks for joining us. We'll see you next time on LA County Close Up.